One of the things that I take great pride in, and I know our teams do as well, is the real privilege of being able to serve this community. And not only the community of Richmond, but also our surrounding counties, the state, and even beyond that. And as we think about the state of the state, there is perhaps no greater issue right now than children's mental health. It is at a crisis level.
We know for a fact a couple of things. First of all, a leading cause of death in teenagers is suicide. And those numbers are going up at very rapid rates. The leading cause of disability in teenagers are psychiatric.
130,000 children and adolescents in Virginia suffer from mental illness. And what we do know is only 20% actually get the health care that they need. This is really difficult in a time where resources are diminishing even further. We're seeing other health systems close down because of nursing shortages. And we want to keep our doors open. And with that, we're doing a lot to invest in our workforce.
Given the focus on children's mental health, which is so pivotal, one of the things that we have really done is take a huge leap forward to say, what is the right model of the future for us to be able to meet the needs of kids?
As part of our mission to make the lives of these children and their families better, the first place we have to begin with is going to where the children are, to go where their families happen to be.
We are seeing with current trends, we can no longer just think of mental health treatment in the confines of the four walls of a mental health institution or an inpatient facility.
My interests have always been building clinical programs in a way that fits the need of the area, so the need of the kids in the community. There's no way to build a program that would fit every community. It has to be special for just a particular area. Child psychiatry should be in the community, and that's kind of our base pillar, is being in the community and treating patients on the outpatient basis. And community outreach and collaborating with other specialties is something I've always been interested in.
And you know, we recognize we can't do this alone. We are really looking to be allies and work closely with our community and our stakeholders. This really is important.
Child psychiatrists don't work alone. Our team includes psychologists, social work, nursing, physical therapy, occupational therapy, many other specialties. And there's a saying, it takes a village to raise a child. It takes a village to treat a child too, to treat a child well.
We have an incredible history within children and adolescent mental health at VCU around philanthropy and the community rallying around to make it happen. And we look to amplify that. And what that will mean is we have all of these new incredible leaders who are coming here to carry this vision forward. We are working alongside them to figure out where do investments make a difference.
It's really a gift to our division is to have the community support. I know it's not like that in other settings and other universities. It's not like that across the country. I think this division is extremely lucky to have the philanthropic support. And you know, sitting in this building, which is just beautiful, and when we're talking about opening up new programs, to say that, yeah, we have space to open up.
This building is a concrete manifestation of the commitment to understanding and helping these kids in a way that is above reproach and remarkable.
But we all know that those beautiful environments, they do drive wonderful experiences. They do make for a safe and engaging space for kids and families and for the people who take care of them. But it's also about the people and the programs that reside inside of those spaces.
My real long-term plan is to have the Division of Child Psychiatry be a national expert, so that people across the country and hopefully across the world would know that you come to VCU for this.
We're very excited about the future, and we're dreaming big dreams. We want to tackle this stigma of mental health head on, and I believe we have the talent, the capability, the focus. We will set the stage here in Richmond.
Our mission here at CHOR is to care for the whole child. And we would not be doing that if we didn't care for the mental health of our child too.
We have lots of kids who are suffering. And so good enough is not good enough. We can and must do better.
As we think about the horizon for what we can do and how we take care of kids, how we influence the world of child and adolescent mental health and these incredible people who are choosing to come here because they see a community that cares and has wrapped their arms around making investments to make a difference in the work that they care so deeply about.
We couldn't do this without the generous support of our community. I want to thank every one of our donors, their passion, their advocacy for making sure that this issue is at the forefront, that we have the ability to go not only invest in new buildings, but really innovative, top-level programs.
I'm very mindful of staying locally in the community and helping the children here. Everything else sort of comes after that. We need to make sure we keep our priority on the kids that live here in the surrounding areas.
We are poised to take what we do here and advance it even further, expanding our delivery of care, recruiting new and talented people into the field, and fill this beautiful building dedicated to making these very vulnerable children's lives better and fulfilling that mission.